Welcome back, everybody, to the OPT Network. October is Breast Cancer Awareness Month, and we know for women, every month we should be connected to our breasts, our breast health, knowing our normal so that we know what is abnormal. Joining us to talk about this very important conversation is Katelyn Charrier Hight. She's a mammography technologist at Christus St. Francis Cabrini Women's Life Center. Katelyn, good morning and welcome.
Good morning. Thank you.
So first of all, I want to talk about the atmosphere when you walk into the Women's Life Center. It is so serene and so beautiful, and it really puts, or hopefully it really puts women at ease, because it can be such a time of tension when you're going in to get your mammogram. Talk about the atmosphere.
Yes, ma'am. We take pride in that. When you walk through those first doors, we want women to feel comfortable because of the exam they're about to do. So we try to make them feel at ease from the time they get checked in to the time they actually start their exam. We want them to feel comfortable. We don't want to make them feel any more anxious than they probably already are. Mm-hmm. So we try to keep them as modest as we can from the time they start getting dressed to the time we're finished.
And I personally have my mammogram at Cabrini and always have. And that's one of the first things that I take notice of when I walk in. It's just how soothing and serene the atmosphere is. But what we know, Katelyn, is that a lot of women, for whatever reason, sometimes we just don't want to know. We sort of shy away from having a mammogram, especially if it's been like, say 5 years and you're at that age and you just got so busy that you never stopped to schedule it. How do you encourage women that missed some years in between to come back and just start the process?
Yes, ma'am. I know for me personally, like say I have a patient and she hasn't been to get her mammogram in say 5 years. I always just say, well, today is your start point. So we want to focus on today and make sure we get you a really good mammogram. Right. So I just try to encourage them and just say that, it's okay. Life gets busy. So start from today and just kind of go forward and don't worry about those missed years, and then just take each day as it comes.
Mm-hmm. That's good sage advice. Now, here's something that I think most people may not even really talk about until the month of October when we start talking about breast cancer. Women touching their breasts and doing their own self exam so that they can understand, okay, these are how my breasts generally feel, and maybe something has changed. How do we help people to just start to feel comfortable with touching their breasts?
That's a good topic. When I went to my training, I actually went to MD Anderson. Most of us do. We go to Houston to do our training for this. They basically teach you best thing to do is start in the shower, where it's just yourself. There's no mirrors. There's nothing that you have to really worry about. There's different directions. You just kind of start feeling, and not hard, just kind of start pressing around on your chest area. Start noticing if anything feels abnormal. I know for younger women, they do have denser breast tissue, so it does feel kind of lumpy. But just notice, I always tell my ladies when they come for their exam, when you do your self-breast exam, if anything just doesn't feel right, or if you're anxious or worried about it, call your doctor. There's no shame in getting it checked out. If it feels abnormal or just feels concerning for you, you need to get that checked out so you have peace of mind.
Absolutely.
So just kind of starting there.
And so there has been a lot of confusion, probably especially within the last 5 or 6 years, about what age women should be screened. What are the experts saying, or what are we saying about age now and when you should have your first mammogram?
Right. Before, it was typically at age 40, women should start getting their yearly screenings. Now they're kind of starting it a little bit early. It's anywhere between 35 and 40. They want you to start getting your baseline. Most women start at about 35. if you have a strong family history, meaning you have immediate family, like your mom, your sister, an aunt, grandmother, someone in that first circle of your family, if they've been diagnosed with breast cancer, they will allow you to start at even age 30, from 30 to 35. But if you're kind of asymptomatic, you're not having any problems, you're a pretty healthy person, they normally start at 35 and then we'll go to 40.
And that's if you have a family history?
Yes, if you have a family history, they will start as early as 30. Before that, they don't typically like to do mammograms because it's harder to see because of that dense breast tissue. But like I said, if you have other concerning issues or family history, they will start a little earlier. But normally it's between around 35 and 40 for just a normal, healthy woman.
Sure. And Cabrini, I know, has been on the front lines of upgrading state-of-the-art technology so that you can detect any abnormalities or any cancer in women's breasts. Talk a little bit about the new technology.
Yes, we have the 3D HD mammography machines. It's very similar to like getting a CAT scan for your breast. That's basically how I explain it to my patients so they can understand. So what it does when we do your mammogram, instead of taking just a flat picture like we normally would with just a digital machine, it takes sliced pictures. So it breaks up dense breast tissue particles, anything, so they can see it so much more clearly. They can pick up a small cancer the size of a pinhead. So it just detects so much more detail than what it did before. So we're really thankful to have that.
So when you initially walk the woman back to where she's going to have the breast scan, I think we're all sort of anxious about the pressure that's placed on our breasts, and some people say it's painful. I just call it a little bit uncomfortable. But how can you put women at ease about the process?
Definitely. For starters, when I know a woman has not had a mammogram, it's her baseline. I tell them the first thing we get in there, I introduce myself, kind of get a little bit of history, talk to them, try to get them a little more relaxed so they're not as nervous, not as tense. And then I tell them from the get-go, before we get started, I'm going to show you how the machine works. And I kind of practice on my hand or practice on a device. This is how it's going to happen. And I tell them, it shouldn't be painful. It is uncomfortable, but they're very quick. And I tell them from the get-go what we're going to do so they kind of have in mind what's going to happen and what to anticipate. And I always tell my patients the best thing you can do is try to relax. I know you don't want to hear that word when you come for your mammogram, but the more you relax, the less your shoulders and your body language is less tense, the less it's going to be uncomfortable for you.
And I think one of the reasons why people sometimes go without having their mammogram is because somehow we think if we don't know, it's going to be better. But the American Medical Association and everybody having to do with detection talks about why it's so critically important to get diagnosed early. Talk about that.
Yes, definitely. Knowledge is power. That's kind of your bottom line. And with these 3D machines that we have, like I said, they can detect the smallest breast cancer. So they can even find it in what they call a pre-cancer stage. So it's not like it was 5, even 10 years ago. So if you can detect it early, the less treatment you have to do, the less involved it is. So early detection really is key. And that starts with your mammogram.
Sure. So for those women that are saying, Katelyn, you were talking to me this morning, what do they need to do in order to be able to set their mammogram up?
Okay. First off, you really need to have a physician, a GYN, or even a family care doctor can order your mammogram. The rule of thumb is as long as you've seen your doctor within a calendar year, you can actually schedule yourself for your mammogram. That's a new Louisiana state law. You don't have to have a technical order for your screening mammogram.
I didn't know that. You can schedule yourself?
That is a new thing. You just have to see your doctor within a calendar year. Mm-hmm. So if for some reason you need to be followed up or something needs to take further action, you have a physician that can follow you legally. And so it goes back to that doctor, your results. So, like I said, just seeing a doctor, and they can schedule you or you can schedule yourself, and then it kind of goes from there. And that way your results not only go to the patient, but it also goes to the ordering physician.
Sure. What's the most important thing, Katelyn, that you want every woman and everybody who loves the woman in their life or in their circle to know and understand about having their yearly mammogram?
I think just the most important thing, as a female, you have such a strong role to play, whether it be a sister, a mom, a wife, you're someone to somebody. So just staying on top of your health is not only doing yourself a favor, but all those people that love you in your life. You're wanting to stay healthy for them. So you really want to try to stay on top of all parts of your body and your health and be as healthy as you can be. So why not start with your breast health and get your mammogram?
Absolutely. And while you're getting your mammogram, you can also schedule an amazing massage or so many services right there in the Women's Life Center. So if you're tense, after you come out, you can go straight to have a massage or have a facial or whatever it is that you would like to pamper yourself. Katelyn, thank you guys for doing an amazing job and making us feel comfortable and special when we come in at that time where it is really a source of tension for a lot of women. You guys do an incredible job. Don't forget, it is critically important that every woman who has a family history get her mammogram, and that we as women that are over 40 have a mammogram every year. Stay on point. We're back after this.